should be able to do this. Okay. When I put this together, I thought we needed some fun graphics because, you know, it gets really boring. I always like the lectures when they shot up a picture of Hawaii in the middle of the bones, and I always thought that was good, nice comic relief. This is me. It's changed a little bit since then, but that's okay. Because she told me I had to put that in there. So you know I was really a doctor. Okay, I was told 3 things we had to talk about. How to do a newborn exam. I'm not really sure why. I can't see anybody really working in the newborn nursery, but maybe that's a new role for PAs now. I don't know. Understanding normal growth and development in children and how to evaluate an infant for failure to thrive, which is actually simpler than you think. And then being able to perform a thorough well-child visit and provide age-appropriate anticipatory guidance, and then how to immunize children. Okay, so newborn exam seems like a good place to start pediatrics. Important things to consider, to look at even before you go in the room. What do you know about the family history, anything about mom's prenatal history, blood type, did she have any infections, does she have anything during delivery that might be an issue. Okay, there's your brand new baby. They're very pretty. Burns from the ugly umbilical cord. My ex-husband used to always say newborns are never pretty. So
that's what is your ex.
Yeah, that's what it is. Okay, it's just like any other physical. You approach it, vital signs, measurements, general assessment, etc. They're a little bit different for the babies, so we'll talk on some of them. Oh, wow, we went through that fast. Let's go back. Okay, so vital signs, things to know. Baby's temperature initially is more a reflection of the intrauterine environment. So if mom has a fever, baby's gonna have a fever. Doesn't mean the baby's sick, just a reflection of where it came from. Vital signs, heart rate is much faster in the baby, usually 150 to 200 range. Respirations are more rapid in a baby. They may be anywhere from 40 to even 70 or 80. Their blood pressure, usually they get 1. You know, it's like in the 60 over 40 range. That might look really strange to some people, but that would be fine. This is a brand new baby. Like I said, they're still burning. This baby hasn't been washed or nothing, so you can see the gloves on the examiner. Because everything on that baby would be potentially contagious. Okay, so we're going to start at the top of the baby's head and feel the fontanelle. So there's an anterior fontanelle and a posterior fontanelle, which is usually maybe the size of your thumbnail. It's usually not very big. You should be able to feel that there are open plates. The purpose of the skull being shaped like that is to allow the baby to be delivered through the vagina. The plates can overlap each other to get out, so it is supposed to be like that. That's why babies have cone-looking heads when they've been sucked out or they've been stuck in the canal for a while. That's all normal. When you look in a baby's eyes, you're not going to do a full fundoscopic exam. You're just going to look to see that you have red reflexes. If you have white shining back at you, that just may be the baby looking straight at you instead of you looking from the side, but it can also indicate a tumor in the back of the eye. So if you cannot get a red reflex, that's something that's very significant and should be double checked by somebody else. Babies' eyes have a disconjugate gaze, so they may look at you cross-eyed or one way, one eye another, a very unnerving thing. That is normal in a newborn up to 6 months of age, so that doesn't always go away rapidly, but it still can be normal. Babies' noses are often stuffy from delivery. They may need to be suctioned. In the oropharynx, things that you want to note, palate, is it intact? Make sure there's no cleft. If you look all the way back, maybe you'll see a bifid uvula. That's where your uvula is actually split into, and it looks like an upside down heart. That can be significant because it can show, it can lead you to the assumption that there may be a submucosal cleft palate. You may not be able to see it looking in the baby's mouth, but it can be significant down the road for speech. Babies can have teeth. They are called natal teeth. They are primary teeth. They're often loose, so they get pulled if they're loose because they can get aspirated. If you have to pull a needle tooth, you've lost your primary tooth. So that's gonna be a child with a little hole in their mouth for 6 years. But that's okay, it's better than aspirating in a tooth. It's not real common, you'll see one every 5 years or so. It's pretty rare, but there's a chance that you can see one in your life. Okay, when you look at this baby, you'll note rapidly that babies don't have necks. So, you have to hunt around through the neck. Usually the neck's a normal exam once you find it, but they can have masses, cysts and stuff. Those congenital things usually don't show up to the babies a few months old, but something to keep in mind during your first few months of old child visits. Babies don't get necks, seriously, till about 4 months when they can hold their head up. Till then everything is like that. Chest, you should be able to listen, make sure there's not a murmur. We now do a congenital heart screen in all newborns in the nursery, so they get pulse ox readings on both the hand and the foot, and they need to be within 3 points of each other so that you know you have adequate oxygenation. If there's a discrepancy, repeat the exam, the pulse ox readings in an hour. If it continues that way, then the baby needs an echo to rule out a congenital heart defect. It's actually very simple, but pretty good screening. It only misses a very few heart conditions. So, and it picks up the really bad ones most of the time. Lungs, most of the time a newborn's lungs are going to be clear, so there's not a whole lot there. But if he is a preemie, you might hear crackles, or most babies are actually born with a pneumonia, but you can have aspiration if they've had meconium. Bellies, you want to make sure that there's normal 3 vessels to the umbilical cord, 2 arteries, 1 vein. You want to make sure that the belly is soft, you can't feel any masses. On a rare occasion, and usually you're going to know about this prenatally, the baby could have an abdominal wall defect, a gastroschisis, omphalocele. Those are almost always not surprises anymore. Moving down, check femoral pulses in the baby. That's very important because it's a good screen for coarctation of the aorta. So you want to make sure you feel both of those. In baby boys, make sure both testes are descended. Make sure there's no hypospadias, that the urethral opening is at the right place. That may be difficult with the foreskin still there. And you would only pull the foreskin back as much as you can without tearing anything. When you're doing the hip exam, this is a little bit difficult to describe. I'll try to describe for you who've never seen it. You're going to put your hands on the outside of the thigh. You're going to put your thumbs on the inside of the upper thigh, and you're going to try to move the hips out or up and out. Another way to do it, it's so hard when you don't have a baby. You bend the baby's legs and put your hand below the knee in a bed position, and that'll let you, if you think about the knee being here and the leg being here, that'll let you get a good hold, and you can see if you can shift the hips out, or if you feel a big clunk. Not really a click. We call it a hip click, but it's not a little, like you might think of when you go and pop your finger. It's a clunk. So there's, once you feel one, you'll get it. You'll be like, wow, okay, that's a hip click. Legs, usually no big deals. There's a lot of congenital positioning in the legs. You might see legs that don't want to straighten out. You might see feet that look goofy. And most of those are just going to be in utero positioning, and will get better with time. Of course, you want to make sure your baby has 5 fingers, 5 toes. Roll the baby over, look at the back. Make sure the spine's intact. Look at the bottom. And most babies are going to have like a little sacral area. You want to make sure that's a dimple, a blind pouch, not anything deeper, no hair tufts, nothing that might indicate any communication with the spinal cord inside. So newborns also go through a few other things. The nurses will do a Dubowitz. It's an aging stage. It looks at the baby's tone and the cartilage, the creases on the feet, the way the baby lays. That's not real helpful for a full-term newborn, but it can be helpful for a preemie, especially if you're not 100% sure of dates and you think the baby may be younger or older than the dates that you were given. That can be real helpful. For a full-term baby, it's just an exercise. It's not really helpful. Of course, APGARs, everybody is aware of APGAR scoring on the baby's heart rate, breathing, color, which reflects perfusion, tone, and what's the last one? Cry. And so there's a total of 10. It's scored at 1 minute and 5 minutes. The 1 minute APGAR is not significant. It just reflects what happened at the time of delivery. The 5 minute APGAR is more significant, and if it's low, then most people will go on and do a 10-minute APGAR to show if the baby has improved over time or with resuscitation as needed. And if you have low 5 and especially 10-minute APGARs, those are very significant for long-term issues. Okay, there's our pretty little baby. Okay, infantile reflexes. There's a lot of them. You may or may not see them in the newborn as much as you see them in a little bit older, a couple days old or a couple months old. The Morrow reflex is called a startle reflex. If you've ever seen a baby do it, you'll laugh because it's really kind of cute. It can be elicited by holding the baby like this and just sort of, you're not really dropping them, the parents think you are, but you're not. And they'll open their eyes wide, they'll throw their arms out and look startled, and they'll usually cry. And that's a normal reaction, and it'll last until about 4 months. If it's still going on after 4 months, you might keep an eye on that baby's neurologic development. Tonic neck reflex is super cool, and I think we actually have a picture of some of these. The tonic neck reflex is, I call it the fencing pose. When they turn their head this way, then their arms are going to fence. When you turn their head this way, you don't have to do anything. They just move their arms. You go like that, they go like this. It's really cool. It's a cool thing to show the parents how their baby's normal. Grasp reflex is just putting your hand in the palm, they will hold on. Rooting reflex is the baby who, you stroke their cheek and then, that's how we get them to breastfeed. Okay. And the plantar grasp reflex is the same thing. When you stroke the bottom of the baby's foot, they're going to curl their toes in. Like if they could, they would hold on to your finger with their toes. I don't think they can. No. Okay, there's your Morrow reflex. That's a pretty good little example. And there's your tonic neck reflex. You can see a good fencing pose there. Step reflex was not listed on the first sheet, but it's really cute. You can take even a couple-day-old baby, but you can really do it with like a 2 or 3 month old, and you can actually make them walk. You put one foot down and they'll lift up and put the other foot down, and then and it is so cool when you have a 3-year-old who thinks the baby can't do anything, and you can show them that the baby can walk. The crab reflex is the same thing. If you put them on their belly and put your feet where they can push on your feet, they will push themselves along, and they will look like they're crawling, and that's really cool for siblings who think the babies can't do anything else. And the moms like it too. Okay, there's reading, stroke the side, baby will open his mouth to feed. There's your palm of grasp. That's a nice picture of that. And flexion of the toes curling in there. Here's your APGAR scoring, respiration. So there's a 0, 1, and 2 on each one of these. So like for respiration, 0 would be a baby who's making no respiratory effort at all. A 1 would be like irregular, somewhat labored, not normal breathing, and 2 would be just, baby breathing fine, crying fine, no issues. So the same thing for each one, so that they total up for a total of 10. And there's the whole thing. And here's your Dubowitz, and you can see how most of it assesses a baby's tone, and then some of the other developmental things. But okay, more fun. A little bit older babies. Okay, y'all should have pictures of growth curves, is what Susan told me. Things to know, growth curves are developed and were recently redone as a composite growth of all children of all nationalities in the U.S. So if the U.S. is 65% Caucasian and 25% Hispanic and 30%, and that's probably over 100 by now, that's the numbers that they take. It's changed lately because of more Asians being in the US, so it did change the growth percentiles a little bit. So I guess most of you realize they're not all. That's okay though, everyone needs to be different. The percentiles, the darkest line in the middle is the 50th percentile. That's average. That means 50% of kids that same age are going to be taller and 50% are going to be shorter. We like to see that the height and the weight are along or close to the same percentile, and that as they grow, they stay on their percentile. Kids are allowed to cross percentiles in height up to 2 years of age. And like maybe you have a baby who was born at 9 pounds, but genetically was not expected to be 6 foot tall. So over the first 2 years of life is when they should get to their future potential. So it's okay to cross percentiles up to 2. If they're crossing percentiles after 2, that's bad. Weight should only cross percentiles down if the height is, so that they stay together. If the height is good and the weight is not increasing, i.e. dropping percentiles, then that's your failed to thrive children, and we'll get back to them. On the back of the growth chart is the head circumference of the babies from 0 to 3. So there are 4 growth charts that you deal with on a regular basis. 2 for boys, 2 for girls. They're 0 to 3, and then 3, or they've actually changed them now from 2 to 20. It used to be 3 to 18. So if there's an overlap between 2 and 3, you can use either growth chart, but you get a better plotting month by month when you use the younger one. Also, the older one doesn't have head circumference on the back, it has BMI. So that's real helpful when you're trying to explain to a parent that their child is overweight. You can actually show them the percentiles, explain, okay, so here it is in their height and weight, here it is in their BMI. They're overweight, they're obese, and it's time we do something about it. But actually looking at the growth chart will help the parent understand a lot too. It's also nice for the parents to have a newborn, especially a breastfeeding mom. They don't know how much the baby's drinking, they don't know if the baby's growing. It's nice to show them the growth curve and show them how well the baby's growing. Girls are pink. There you go, girls are pink. Okay, kind of general rules of thumb that people always think about. A newborn is going to lose weight. Almost all newborns lose weight, up to 10% of their body weight. More than that is not good. Breastfed babies take longer to regain their weight than a bottle-fed baby, just waiting for mom's milk supply to come in. But all babies should have regained their birth weight by 2 weeks of age. In general, the birth weight is going to double by 6 months and triple by a year. So if you have a kid who's 8 pounds, by 6 months you ought to be 16, and by a year you ought to be 24. And if you think about it, that fits most kids pretty easily. Most 1-year-olds are somewhere around 20 to 25 pounds. And then as a general rule, during the first 3 months, the baby should gain 1 ounce a day. That's really important if you're watching a baby who's not growing well, especially in the first couple weeks of life, that they should be gaining 1 ounce a day. That lets you know how they're doing. Just the other interesting numbers about the height. The average length on a baby is 20 inches, and by a year, the birth length increases by 50%. So, 10 inches more, the child should be 30 inches. Okay. Birth length doubles by 4 and triples by 13. Nobody ever thinks of that like they think about the weight. Depending upon who you read, and the height at 2 years is approximately half of their adult height. Some people say 2.5 years. But kids like to hear, how tall am I going to be when I grow up? So you could look back to where they were 2, or you can just follow where they are in their percentiles on the growth chart and say, well, you've always been 75th percentile, so when you're done growing, a girl would be 5'6", and a boy would be 6 foot. For younger kids prior to puberty, the average growth is 2 inches per year. It can be as much as 5 during puberty. This is just ideas on how much calories kids need in the first couple of years of life. And, lots of questions on teething and teeth coming in. So I want to say a few things about teething. Teething doesn't cause fevers. Maybe 100. Never above 101. So never send somebody out of your office with 103 fever and the parents think it's just teething. It may be nothing, it may just be a virus, but don't let them think it's teething, because it's not. Even if 5 teeth are coming in, it's not teething. Okay, parents all think their babies are teething at 3 to 4 months when they start chewing, drooling, and slobbering. I'm here to tell you that every 4-month-old chews, drools, and slobbers. They put their entire fist in their hand. They are not teething yet. You look at the gum, there's nothing there. The average first tooth comes in between 7 and 9 months. Most 1-year-olds will have 8 teeth, 4 incisors on the top, 4 incisors on the bottom. Molars come in usually between 12 and 18 months, and canines or pointy-eared teeth come in about 18 months. 2-year molars, usually about 2.5. Now, of course, there's lots of variations. This shows you that. Most kids start losing their primary teeth between 5 and 8. If you were an early teether and you really got teeth at 4 months, that does happen, just not as often as people think. You're probably going to lose your teeth at 5. If you're an early teether, you tend to lose them earlier and get your adult teeth earlier also. Many people don't know that babies are largely cartilaginous. So if you x-ray a baby's leg, you're not going to see a kneecap. If you x-ray a wrist, you can see some little bones, but you're not going to see an entire wrist, all those bones in there. So that can be actually useful to help determine the baby's bone, or the child's bone age, so that if they're not growing well, you can send them for an x-ray of their bone age and kind of get an idea if their bone age is on time, early or late, which can help you to assess their overall growth. And this just shows some of that. Just so you kind of realize that, that's all. I would not expect you to memorize that or anything other than knowing it's there as a reference. Okay, weighing a baby should be done on a scale, and it needs to be calibrated periodically. You can use an electronic one. We used what is that thing called we used, Susan? A balance one.
Yeah,
Yeah.
It's a balance.
Yeah, and so you have to send your little things back and forth, zero them when the baby's up, and recalibrate the edge periodically. And older kids should stand on a scale not like the ones you have at home. They're not very accurate, and in fact they don't even weigh under 25 pounds very accurately at all. So you always want to have a professional scale, not a Bath and Body Works scale. And I'm here to tell you that it doesn't matter what you do to a scale, every baby's going to cry. We have heated scales, put heating pads on them, underneath something for the baby to make them warm, and they cry anyway. That thick lamb's wool stuff that they use in the NICU to make the baby so comfortable, scream on that shit. So it doesn't matter, that baby's going to cry on the scale. Measuring height, you should use a stadiometer for the older kids who can stand. And because my nurses aren't really very accurate with the stadiometer, I stuck levels on it so that you can actually be sure that you're not measuring them like this with that stadiometer going down their head or up this way. And of course you have to have the child's heels all the way back, standing straight and looking at you, not, all the things that kids do. And that will give you the very best, most accurate height measurement. But on a baby who can't measure for height, don't use the nursery technique, which is to hold measuring tape next to the baby, go 19. This is a measure mat, and this is your, yeah.
Or point their toes.
Oh, yeah.
We had, when I was over at an Integris pediatrics group, we had this rash of infants that lost height between their newborn and between their being born and then their newborn visit. And we finally figured out there was one nurse over in the newborn nursery that was pointing the baby's toes to measure their height.
Wow, no kidding.
That's special.
Yeah, well, you want to do that with the measure mat because you lay that out, you lay the baby down. You have to make sure the head is against this edge at the top. Then the bottom flips up, and there's a straight thing like this that makes a 90-degree angle that you put against the baby's heel. So now you're measuring the baby exactly. But you think that's easy? That baby wiggles and his head is no longer here, or he's scrunched his neck, and so even that takes a little bit of practice. And what I tell my nurses is, if the measurement doesn't look right on the growth chart, don't do it. It's probably not right. Oh, I guess we're talking about theta throw. Okay, so what is it? There's no universally accepted definition. So usually people use one of these three. Somebody who's severely underweight for their age, less than 3rd percentile, or less than 80% of their ideal weight. For example, if you have a kid who's off the growth chart on his height, really tall, but he's only measuring 25th percentile in his length, that could be an issue as well, even though they're not less than 3rd percentile. And then crossing 2 percentiles in the weight when the height is not. 3 reasons organic disease can be so many. Those are the things that we screen for. Environmental deprivation, that's going to have to be your history. You need to know your families. Many times in the hospital we see people hospitalized and accused of this because they don't know the families. Once they start understanding the family situation, then you can help decide, is it environment or not? And it may be environment, but not a true deprivation. It may be anything from a lack of understanding, parents who mix formula incorrectly, so they're not giving baby the calories they think they're giving the baby. It may be a parent who doesn't understand they need to wake the baby to give feeds, and so the baby only eats, who would think a baby would only eat 5 times a day, but so there can be environmental reasons that aren't always a neglect or abusive situation. And many times you never find an explanation, which is okay as long as you've ruled out the bad things. So I'm sure the next one is some awful list, yeah, I just have to think about. We'll just touch on these. Cardiac is a very common one because a child who has a congenital heart disease is going to burn up calories much faster than a baby with a normal heart. So they need more calories. If they're not getting more calories, they're not going to grow. You wouldn't think that'd be the same neurologically, but a baby who's hypertonic, a baby who has frequent seizures, a baby who has cerebral palsy, they burn up a lot of calories also. Even though you wouldn't think so, they do. And also, if they're neurologically abnormal, they may not be taking in as many calories because it may be harder to feed them. So the combination of the two can lead them to having poor growth. A lot of GI reasons, and probably more GI reasons than anything else. And most of these either come down to not keeping enough calories in or too many calories going out. So, reflex, throwing up, losing your calories. Chronic diarrhea, if you're not digesting, you're losing calories that way. Celiac disease, again, not absorbing, so you're not absorbing your calories from your wheat product. Cystic fibrosis, that can be either the absorption side or the respiratory side. Either one of those can lead to failure to thrive. And most babies, when they're little, have one or the other to present with. As they get older, most kids will have both. But as a young baby, they may have only failure to thrive. They may have only GI aspects of cystic fibrosis, or they may have only pulmonary aspects. Chronic infection, believe it or not, but a chronic UTI is a cause for failure to thrive. So it's really important to always check your urine when you're evaluating these kids. Very important to get a good feeding history. If they're breastfeeding, how long does the baby nurse? Both sides. Does mom's breast feel full afterwards? Or does it feel empty? Does she pump? Does she have a pump? Can she pump and tell you how much milk she has? How much milk she has after feeding the baby? If she can pump 4 ounces before a feed, but she can pump 3 ounces after the feed, that might explain a lot. Baby's only drinking 1 ounce. But mom doesn't know that, so she thinks everything is fine. Formula, again, make sure that you know that the parents are mixing the formula correctly. And I just tell me how you mix your formula. And they look at you like, well, what do you want to know? I said, okay, you're going to make a bottle of right now, tell me what you're gonna do. That way you can be sure that they're putting 1 scoop in, 2 ounces of water, and not some other ratio. Baby, very important that you have really good measurements. So if you're not sure, do a repeat. That'll tell you better than anything else if you're good. Looking for signs of chronic illness. Baby looks emaciated, big bloated tummy, or like tummy that sinks in, like there's no adipose in there. Especially if you've seen the baby several times, if you can see wasting. The arms used to be full and now they're like little lady arms, and you've got skin hanging down. That happens to small babies too if they lose a lot of weight. So looking for signs of wasting. If a baby's having chronic diarrhea, they may have red raw anus from all of that. Your kid with cystic fibrosis may have crackles in their lungs. Screening labs, this is what every baby with Fit to Thrive needs to have done. CBC, looking for signs of chronic infection or anemia so that you wonder why. Evaluate that. Chemistries to make sure, and that should include liver as well as kidney function tests and electrolytes. Make sure everything's working normal. Thyroid, congenital hypothyroidism is rarely missed anymore, but if it's still an older kid, they could have hypothyroidism that wasn't congenital. So if you have like a 9 or 12-month-old, you really have to think about that as opposed to a 2-week-old. They should have had an abnormal newborn screen. Urine and urine culture for the chronic UTIs that we talked about. For the most part, that's what most pediatricians are going to do in their office. If they really feel that there's still an organic cause, then most people are going to refer out. Referral specialists can do all kinds of things, from celiac panels to stool studies and urine studies for absorption and malabsorption and amino acid deficiencies and all kinds of other things, and that's why they get to be specialists. The rest of us don't like that stuff. Non-organic Fit to Thrive, parental depression can be a real biggie because they may not be recognizing the baby's cues to eat. They may be letting the baby cry for a long time, which burns more calories. Abuse and neglect is a possibility always. That's why you need to know your families. Financial, the mother who can't afford the baby's formula is going to make it stretch by thinning it out with more water. So you just don't know what the underlying things are unless you know your families. Oh, and the latest thing in the pediatric literature is screening dad for postpartum depression. I'm not doing it. Somebody else can worry about the dad. They don't even come to the office. Okay, children's development is broken down into 4 areas: gross motor, fine motor, speech and language, and social personal. We'll talk about each of those. And this is where it gets fun. Oh my God, Susan, I can't read that. Did I put that in there?
You did.
So, okay, just how speech develops over the years. Good, you all have to read that one, I can't read it. Lots of causes for speech delay, and when you're evaluating child's speech, you have to think, what is the problem with their speech? Is it articulation, meaning they're not making the sound so you don't understand the words, or is it a true speech delay? So articulation, those are kids who, you know, they talk to you, but they say, they can't say their blends, they can't say their R's or their W's or their L's or their Y's, and so the words sound funny, but they're still talking up a storm. Delay is kids who aren't talking at all, or they're still talking baby talk when they should be using words like after 2, 2.5. So there's lots of causes for that, and you can see that a lot of them are things the baby's born with. Most babies who are born with a hearing loss we do identify now, and a lot of times in those babies there is a family history. Mental retardation is not a diagnosis you're going to make in a baby until they're much older. But looking back over time, then you'll be like, okay, so that's why their speech was so delayed when they were younger. Expressive language disorder gets all kinds of new words. Developmental expressive aphasia. That's your kiddo who talks up a storm, but you don't understand a word they say. It's good that they're talking up a storm though. If those kids don't talk at all, that's really bad. Kids who are bilingual actually usually do really well, and I encourage all of my families who speak 2 languages in their home, be it English and Vietnamese, Spanish and English, French. I mean, I probably have every language spoken somewhere in my practice. I tell them all, teach your child both. Don't send them to school not knowing English. That's a common problem I see in Oriental families. They want them to learn their language, but they don't teach them English also. Then they go to kindergarten seriously knowing no English. By the end of the year, trust me, they know English well. But how hard is that on the kid? So, and then as they get older, they don't want to bother with their native language. So I continue to encourage the kids, use your Spanish, use your Vietnamese, use your Korean. This is a great skill to have. And for the most part, I don't see significant delays in children who learn both languages at one time. Psychosocial deprivation, that's a parent who maybe they have their own issues, they don't talk to the child, they don't read to the child. If the child doesn't hear somebody talking to them, they're not going to talk. Or they'll babble for a while, but after a while it's going to go away because they're not hearing anything now. Autism is almost always associated with some type of language abnormality. It would be very unusual for you to say that you have a child in your practice with autism who has no language issues at all or didn't when they were younger. It can be speaking later, it can be the manner of speaking, it can be lack of intonation, all sorts of things. Elective mutism, very rare, but it does happen, the child who just chooses not to talk. Receptive aphasia, they can talk, but they can't understand what you're saying, so it's hard for them to speak correctly if they're not hearing correctly. Cerebral palsy, everybody thinks it goes with mental retardation. It may, but it doesn't have to. And cerebral palsy by itself is much less likely to cause speech and language delays than mental retardations. This is an early language milestone. So it's a tool that you can use to assess somebody's language while they're under 3. And much like using the Denver, which we'll get to in a little bit, it gives you age ranges. A kiddo who falls into the white on those scales is in the normal age, but the darker colored, gray, black, blue, whatever, there's actually 2 tones in there. The middle color is still within normal range, just a little bit on the slow side. And so you wouldn't consider those kids to have failed the test, they're just a little bit slower. But if they're all the way out there in the black area, then they're getting a failing score. This is the cat and the clams. Cat is, oh boy. I'm trying to think what the initials stand for. Anyway, one of them is fine motor development, the other one is language. And so this is super easy to use because the number's down the side of the number of months of the child. So all you have to do is go with 6 months old, should be doing everything up to and including babbling. So if you've been seeing your child all along and you do this developmental assessment at every visit, you should have already had that at, 3 to 4 months they were cooing, that they turned when their mom talked to them. So at 6 months you can go, okay, are they doing this, are they doing this, are they doing this, or get the baby to do them even better. And that'll give you a real good assessment of how the baby's doing. Just following right across, you're doing your fine motor skills, and on the fine motor skills, this test is designed not to ask the parent, but to have the baby perform those skills. So in my office, I have nice little baskets with all these toys in them. So when you read the one that says transfers objects or moves things from one hand to the other, we put a small block in their hand, they hold on to it, and then we give them time to play with it and see if they'll move it into both hands. Then we'll try to give them a second block and see if they'll hold on to something in each hand. So we actually are having them do these skills.
Oh, you can translate.
Oh, okay, much more accurate than just taking the parent's report.
Do you do these at every well child, or just if the parent brings something up?
Every well child. Yep. And some insurance companies pay this well to do that, and some don't pay at all. Some put it to the patient's deductible. We don't charge the patient, we write it off. Parents would not understand that they're getting billed $150 to watch their baby play, but it's very important. I used to, before I actually did this hands-on developmental assessment in my office, I used to be diagnosing kids with autism at like 5, and I'm like, no way, this child didn't develop autism at 5. You go back through, and there they are, 3 years. Mom says yes, 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 yes. Mom says yes, 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 yes. I'm like, okay, parents are not good indicators. Either they themselves are in denial of their child's issues, or they don't want to admit to you that the child's not doing those things because they don't want to hear what you're going to say. Best way to do it is to have the child perform. It's actually very fun and the parents love it. And if you have a new parent, when I have a new parent to my practice who's seen somebody else and then they come here at like 15 months and we do these things, they're astounded, number one, because nobody's ever done that before. And then they really get to see their child perform and they're just like, wow, this is cool and I can't believe you do this. And then they tell you their friends and they tell their friends and that's how you really practice. But you have a much better assessment of your child's development when you can do it hands-on instead of just what the parents tell you. It's a lot more fun too. So motor development, different skills that they have at different age, that's just there for your reference. This is just another format for that. And there's another one. So you just have different ways to look at it. We're not going to do a Denver, I'm just going to explain it to you. You can see that there are 4 stairways. The very top one is your personal or social. That's things like interacting with other people, doing things around the house, dressing themselves, playing games. The next one is going to be speech and language, so it's going to start off with simple things. Is that what the next one is, speech and language? Nope, it's not. I don't remember now. Okay. I get close enough that I can see it. I had LASIK, but now there are things that I can't see. That's what
It's just a blurry image.
What does the second one
I
say?
got a good Denver on the,
Yeah.
there's a good Denver
Okay.
on your,
That's why it's like they should be able to read. The third one will be language. And so all you're going to do is take your pencil and a sharp edge and just draw a line straight down 6 months. Check all the things that cross the line at 6 months, some of which you'll have to ask the parents, some of which you'll try to get the baby to do. Like, does the child wave? You wave to the child. Does the child wave back to you? If a child can wave, they ought to wave back to you unless you've scared them, but most of the time. So again, you're trying to elicit as many behaviors as you can. And I actually designate them differently on there. I'll put a P for passing, meaning I actually saw them do that skill. I'll put an R for parent report. I'll put REF if the child just refuses. Sometimes between 1 and 2, the kids aren't going to do anything you ask them to. That's normal at that age. Frustrating when you're trying to do this, but not an uncommon response at that age. So I'll write refuse so that I remember that that's, we did not do it one day. The child just wouldn't cooperate one day. And then an F means that they really did fail it. You don't fail a Denver unless you are past the blue. So if you have a kiddo who is in the blue for 50% of their skills, but they're passing them, they're still okay. It's if you're past that blue mark and they still haven't gotten that skill, that's when they fail that group. So I get a lot of reports that they failed their Denver, but when you go back through, they're just on the blue side. And you just keep an eye on their development and repeat it next time they come in and see how they're progressing. The back of the Denver shows, gives you instructions on how to do different skills you might know and gives you things you need to do. Like under one category, you need the child to draw a circle, and you're actually not supposed to say, draw me a circle. You're supposed to say, draw this shape right here. So that they don't know it's a circle. Well, they probably know it's a circle, but you want to see it. And for drawing a circle, all they have to do is some kind of round shape that comes back together pretty close. It doesn't have to be a perfect circle. The 2 lines there are for the part where it says, have the child point to which line is longer. And the important thing on that is the word longer. You don't want to use a different word, you want to use longer. and they get 2 out of 3 chances to get it right. And then the animals, and that strip of pictures are for when you ask a child to identify or to point to. When they're younger, they don't have to name kitty, cat, horse, bird. You just say, which one's a kitty, which one's a cat, whatever, and they point to it, and it's just so that you have that stuff right there. I actually printed colorful, more updated pictures, laminated them. We use those. Not that I'm an overachiever. Okay, the well child check is, it's actually a lot of fun. It's where you really get to know your patients. Sometimes they seem like, oh my God, they're never gonna end. We've got 10 of them today, and they take 20 minutes and they're only booked for 15, but they are a lot of fun. Measuring the child, we talked about everything before except measuring the head circumference. They actually make these special little circular measuring type things so that you get a more accurate measurement, and you can usually get those by either ordering them, or a lot of times the formula reps will have them for free. Anything you get for free is good. But you want to try to measure the biggest part of the head, so you might need to move it around a little bit. And again, I tell my nurses, if it doesn't fit, if you plot it and it looks 2 centimeters smaller than the last time, go back and remeasure. But the head growth is really important, and it should closely track the height growth. Not necessarily the weight, because you can have a really fat baby or a skinny baby, and their head may still be growing fine. If you have a baby whose head is like 90th percentile, and the height and weight are only 25th, who's going to worry about that? Well, you need to know a little bit more. You need to know, has the head always been that bad? Or has the head grown? If the head was 25th percentile at the last visit and now it's 90th, you better worry about that. If it's always been large and it's always tracking large, simple question, does anybody in the family have a big head? Parents know if they have a big head. They can't buy a hat, they can't get a shirt over their head. They've been told all their lives they have a big head. It's often dads, sorry guys. But, and most dads know, can they buy a ball cap? Do they have to adjust it? Were they in the military? Did they have to buy a big hat size? Can they pick up a cowboy hat and put it on, or do they have to have a special made one? Most guys don't, they have a big head. So, but familial macrocephaly is probably the biggest cause for a big head. But if you have a baby who's always been growing with a certain head percentile and it gets a lot bigger, it's an immediate alert to recheck it, do a thorough neurologic exam, and feel that skull well to see what's happening. Okay, so when do we see children for well child? In my practice, we see them a day or 2 after they go from the hospital, and we may see them many times until their weight gain is established. But those we just call nurse visits, and we weigh them and we assess how they're feeding and what's going on. They don't get thorough exams and everything at those visits unless there's an issue. The actual well child visit is going to be at 1 month, 2, 4, 6, and then every 3 months, 9, 12, 15, 18, and then 2, 3, and 4. Long, long time ago, maybe when I was a student, there was a 2.5-year-old well child, which was really helpful because in a 2-year-old, it's a long time till 3. And there can be a lot of issues, especially with speech and language. But the insurance companies decided they didn't want to pay for that visit. So the American Academy of Pediatrics, instead of standing up to the insurance company, said, okay, then we won't recommend one. So I tried to instill in my parents that after their school shots at 4, they should still come in for well child visits, not wait again till they're 12 the next time they need shots. So ideally your child should still get a well child visit every year. Okay, and this for newborn. Okay. So cute. They still look like little old men. You can buy forms, you can make forms, but almost everybody uses forms for their well child visits. It's quicker, it's all the information there, so while you're still young and learning, you don't have to rack your brain or have a cheat sheet like you do when you're a resident, that tells you when they do things at different ages. It's all on there, and you can just whiz through it and make sure you've done everything that you want to do and add anything to it that you need to. So I have used other people's, several different ones, added my own touches, over the years come up with the ones that I have on here. You can buy them from the American Academy of Pediatrics. You can find them online from different practices. We'll put theirs online for people to get ideas from or whatever. But it's so much easier than having a 4-page dictated note on your electronic medical records. That's what I get from people of electronic medical records. Now, when I was in the Air Force, we would have 3 or 4 ages on there at one time. So you'd have skinny little columns. And it would be really hard to add anything to it. So when I got out of the Air Force, I was like, I don't think I want to go with that system. Yes, it condenses your paperwork, but you can't really add anything to it. So this gives you the opportunity to add anything you need to and still fit it all in one page. And so I made these for every age visit, and we just have them printed, and it just makes life a lot easier. I also wrote for every well visit a summary sheet of things parents need to remember. If you think about everything we've talked about so far, you're weighing and measuring the baby, talking about their eating, talking about their development, thoroughly examining them, talking about issues they have, and then trying to provide age-appropriate anticipatory guidance. Parents can't take that all in. So it's good to walk away with something. A lot of times parents will read this while they're waiting for me to come in. That's good. Then they can ask questions. Or they can say, I see that I should be doing this, or the baby should be doing this, but I don't think he is. So it gives us something, a starting point for the visit if they have certain issues that maybe they didn't even realize. And it brings up some things that you might not think to say every time. Because once you've said it once, you don't want to tell the parent every time they come in, make sure your hot water heater's set at 140 degrees. But it may be on this for many months until the parents have already taken care of that and it's just a normal part of their life. See, look at the 1-month-old looks like a baby down, not like a little old man. But still, no neck, they'll lay on their tummy, but they won't lift up their head. So the way these are arranged, you can put parent concerns, gives you a place to write about what their nutrition is, if there's any issues. There's a general assessment of their development, but we still do the other things. And then it gives you some anticipatory guidance things to make sure you talk about. And at the bottom, it reminds me to look for their newborn screening results, PKU test from the hospital, to give them their second Hep B shot, etc. And that's just, I just included those so you could read them, and it'll give you a good feel for different babies at different age. Also, many years ago, the American Academy of Pediatrics says, we need you to screen our moms for postpartum depression. They're supposed to be screened by their OBs at their 6-week postpartum visit, but we don't trust the OBs to do it, so we're asking you pediatricians to do it. Thank you very much. So I asked my moms to fill it out, and it's a rare mom who doesn't already know she has an issue, but it does give me that information that I might not know, especially if it's a new family. I'll just bring it up by saying, well, you scored a little bit high. Are you having trouble? Are you getting enough support? Usually either the water gates will open and I hear more than I want to know, or yes, I had trouble after my last baby, or yes, I take Zoloft every day, and I know I'm feeling a little blue, but my husband is really picking up and helping out. So if they're really high and I'm really worried about them, I can have them repeated in a month or 2 to make sure that they're improving. But most of the time I just ask them. And some moms will say, yeah, I know, but it's still better than last time. So you get all kinds of responses, but it's rare for me to actually have a mom say, oh, really? I'm not doing well? I thought I was doing great. So if they're really doing poorly, I do encourage them to see someone, not me. Talk to your OB, talk to your family practice doctor. And this is just the scoring system for that. Some of them are 0 to 3 and some of them are 3 to 0. That's the only way it is. And you don't have to memorize this because what you'll do is you'll read the question and know which way it is. It just makes sense, so you can score it without the scoring sheet. 2-month-olds, now they're getting really cute because they're smiling. And so things to think about with your 2-month-old, when they lay them in their belly, they'll start to push up, not all the way, but they should push up on their forearms. They'll be making happy cooing noises and smiling, and that warms a mother's heart tremendously. So you ought to be able to see some good bonding between the baby and the mom by this age. They should start bearing some weight. They may not do it great, but they should be bearing some weight, and that's pretty much it. Head control to some degree, but even when you've got them upright, they're going to flop around some. The summary information, also at 4 months we start the shots, and I have them written down there, but they change so many times. I quit updating the forms just for the shots. So while this indicates to give pediatrics, Hib, and Prevnar, I now give Pentacel, Rototec, and Prevnar. So, and I just handwrite it in now, but you could update it to reflect exactly what you're given at that age. And then 4 months, they're getting to be super fun. You can see that they'll push all the way up, which is really cool. It makes for those great baby pictures. They'll sit up really well in a bumbo chair, not by themselves yet. They'll start making other sounds. High-pitched squeals. Why do they do that? Because they can. They love to hear their voices. They're laughing now. They're really enjoyable. 4 to 6 months is a special time in a baby's life. There's something new almost every day, a new sound, a new skill, a new food, something new almost every day, which makes it super exciting for the parents. And a 4-month-old will idolize his siblings. A 4-month-old will laugh more for his 3-year-old brother than he will for his mom. And so it makes for a real good bonding time for siblings, especially if they haven't been real happy with a crying baby. So 4-month-olds are really special kiddos. They get their second set of vaccines. And 6-month-olds can sit up by themselves. They can get up on all fours. They might rock. They might take a step backwards. Usually babies crawl backwards before forwards. Most babies aren't actually crawling at 6 months yet. But they do usually sit very well, which makes it a lot of fun. Or a lot of things. I like that baby's waving at me. If they haven't started feeding baby foods at 4 months, 6 months is the time to start. I only start a baby at 4 months if they need more calories, they're not growing well. They're breastfeeding and mom feels like she's not keeping up with her breast milk supply, so rather than supplementing, we'll feed. I'd rather have them feed baby food than get formula. If they can wait till 6 months, I try to get them to wait till 6 months. I will tell you that the first child is going to get fed younger because the parents are so excited to feed the baby, they can't wait for you to give them permission. So if they're going to feed at 4 months, you have them start with rice cereal. It's the least allergenic. They make it thin for the first few days because their babies have a strong tongue detruser reflex. That means they go and push everything out. You have to push it back in, and if you can't get it to stay in, they're just not ready to eat. So then wait a week or two, try again. Once they're spoon feeding fine, you're looking for any signs of constipation, vomiting, tummy cramps, anything that might indicate they're not tolerating solid foods well. After they've been on cereal for a week or so, you can have them start fruits and vegetables. And there's no truth to the thing that if you feed them fruits first, they won't eat vegetables. You ought to taste baby food. If you haven't, when you have a child, you should taste everything you give your child. Baby fruit is sour, in my opinion, and bananas are disgusting. But vegetables, squash and carrots and pumpkin are fabulous. So are plain meats. But a 6-month-old can have fruits, vegetables, cereals. They can start meats if they've already been on all the other foods. They can go to stage 2 baby foods if they've already been doing 1s. 2s are just blends, like peaches and pears, and they introduce meats. We don't start finger foods till 8 to 9 months. Some babies later, if parents describe their kids as being gaggy, I tell them there's no rush to start finger food. Most parents will have been eating finger foods long before I tell them to. Sometimes because the child grabs their food. At 6 months, if they're eating a lot, they're gonna drop back a lot in their formula intake. If they're still drinking a ton of formula, I encourage them to start feeding and cut back. A 6-month-old only needs about 24 ounces a day of formula. And some babies, once they get that taste of food, they don't even want 20 ounces. So parents are like, what's the littlest amount of formula? That's okay. So you can always put formula into cereal and give it to them that way too. Okay, 6-month-olds get their 3rd round of shots. If it's flu season, they start their flu vaccines at 6 months. Babies get split dose flu, so they get half a dose now, half a dose in a month for the 1st year only. That's to boost their immune system and prevent side effects. So if you're giving a baby flu shot like you should be, they're not going to have a lot of side effects. The flu vaccines that are made for children are made to a much higher quality of purity than the ones that are made for adults. It's reflected in the price. So it costs a lot more to vaccinate a child for the flu than it does for an adult, but they have less side effects, and a lot of my parents get their flu shots in my office. For that reason, so 9-month-olds, these are now mobile kids. Either they're in walkers and they can move around, often they'll push backwards, they may be crawling, they're sitting up well on their own, they're holding their own bottles, they're babbling, they're usually even to the point where they'll say mama and dada, and it may or may not be specific. Specific means they only say mama for mama. Non-specific means they'll call anybody mama, man or woman, or any dog. And yes, dada is usually said before mama because duh is easier to say than ma, not because babies love their dads more. So, sorry guys. But you should have much more vocalization with more sounds at this age, guzz and buzz in particular. And the 9-month-old should be a busy person. They should be pulling up on furniture, cruising around. They should be crawling or rolling all over the place. They should be wanting to feed themselves. They should be exploring, which means every cabinet they can get into, they will. And wait till they get turn 1. That gets even worse. Car seats, I just want to take a moment to say, over the years, this has changed tremendously. Used to be that babies were in rear-facing car seats until they were 20 pounds. Guess what? My kids were 20 pounds at 6 months. They faced forward 6 months. Now we keep our kids rear-facing till 2, and within the last month, the American Academy of Pediatrics put out a statement that says, we think you should keep all your children rear-facing in their car seats until they're big enough to go to a booster. Now, how many of you are going to keep their 4- and 5-year-olds in a rear-facing car seat? So what I tell my parents is this is the latest recommendation. Practically speaking, keep your child in the rear-facing car seat as long as you can. It's the safest position, especially in a head-on collision. When your child absolutely will not tolerate that anymore, put them in the rear-facing 5-point restraint. The safest thing to be in. Don't put them in a booster seat until the shoulder strap goes up to go down. That means they've outrun their car seat, and they're ready for a booster. Keep them in a booster through age 8, which means they don't come out till they're 9. Okay, some kids don't like that. They think they should be out before then. You'll have some big 8-year-olds that will be like, I don't need that. My oldest son is 6'5". At 8, he was plenty tall. But when I finally let him out of that booster, I couldn't see him. He dropped down so far that I couldn't see him in the rearview mirror. Who would have expected that? So he was a tall kid. I was happy to leave him in the booster as long as he would stay. And his friends would get in the car and they would go, we don't ride in those things anymore. You do in my car? Oh, okay. So as long as you just take a practical approach, most kids will stay in their cars. Okay, different things at 9 months that maybe we didn't have to bring up before is, one biggie is dental. If the babies do have teeth, you have to start having parents take care of the teeth. So at this age, no bottles in bed at night. they should start brushing the tooth, or at least wiping it down, preferably brushing it, and nothing after brushing the teeth but water. So babies who have nighttime feeding should be given water only if they're still feeding at night. Really, a baby doesn't need nighttime feedings after 6 months, and it will help them sleep through the night if you can extinguish those feedings. But the guidelines on fluoridated toothpaste has changed so much. It is now absolutely fine to give fluoridated toothpaste to a baby, even under 1. Used to be a big no-no. You're supposed to give a small dot to a baby under 1, a pea-sized dot to a child up to 3, and a larger dot, but never, even an adult doesn't need a full toothbrush of toothpaste. So save your money on toothpaste. But parents should brush with the kids. They should let the children brush, maybe not at 9 months, but certainly by the time they're 2, they should let the kids brush too. As a pediatrician, I was taught brush your kids' teeth till they're 5. When I let my kids brush their teeth on their own at 5, they go. I'd be like, that's not gonna fly. So I asked the dentist, pediatric dentist, what is your recommendation? They say 7, brush after your kid till they're 7. And I think it probably just comes down to how well your child brushes, but I'll tell parents, for those 2-year-olds who, well, I can't brush their teeth, they won't let me in their mouth. This is the battle you need to win. You're gonna pay thousands of dollars in dental bills if you let that baby take that bottle to bed and don't brush those teeth. So, and it's so awful to spend thousands of dollars on baby teeth that will fall out in 2 or 3 years. So we need to be preventing this. We need to have kids brushing their teeth and getting off the bottle or any kind of milk products or formula products after they go to bed at night. So for a child who won't let the parents brush their teeth, have the parents work together, they sit facing each other. Baby sits on my lap, faces me, and I drop the head down, hold the baby's hands and legs, the dad brushes the teeth. He can control the head, he can brush the teeth. And that's a controlled situation. After you do that for a couple months or a couple years, the child will finally say, oh, I need to let my parents brush my teeth, and it will quit being a struggle. Some kids will catch on faster than others, but that's a battle you want to win, not what color they wear to school. 12 months. The average child will walk at 12 months. That doesn't mean if you're not walking at 12 months that you're delayed. You can walk as late as 18 months and still be okay. But after 15 months, I'm doing really good neurologic exams on those kids to make sure everything is okay. But at that age, parents are worrying too, so when you do that, you're showing them, you're listening to their fears, you're making sure their child is okay, or if not, we need to have a plan. If everything else is normal and the kid is walking, holding on, they may just be afraid to let go. That's a very common kid thing. So I really encourage them to walk behind walking toys because it's less of a dependence than their parents, and they'll let go faster. But they sure are cute. Watching our first one learn to walk is probably the highlight of our parenting years. They start walking like Frankenstein. They walk with their arms out like this for better balance, and they have a broad-based gait to improve their balance, so it's really funny. So at a year, they should be switching off of formula to milk. Most kids will just switch. An occasional child who decides they don't like the taste of milk, you can try weaning them 3/4 formula, 1/4 milk. When they're happy with that, half and half. Then 1/4 formula, 3/4 milk until they're ready to drink whole milk. The other thing I find that can help for the kid who doesn't want to drink milk is give them chocolate or strawberry. And when you've got them drinking milk, then start weaning the chocolate and strawberry out till they're drinking white milk and they don't even realize it. It's awful how few kids drink milk. You would be amazed. Probably if I asked you all who drinks milk here, I'd probably have 3 people who drink milk. It's getting that way with kids now. Kids are drinking more water and less juice, which we really want. More and more parents are not buying soda, so the kids aren't drinking soda. But you would be amazed at how few kids drink milk. So I always encourage drinking whole milk. They should be on whole milk till they're 2. After that, they can drink any milk. But I'll tell you, if I have a super skinny kid, I recommend they stay on whole milk for the added fats. The reason we do whole milk between 1 and 2 is not for body growth. It is for brain development. It's for brain growth. And when you tell that to a parent, they're going to keep that kid on whole milk. You know, they might be like, well, we all drink 2%. Well, this is for your baby's brain growth. Oh, okay, I can do that. I'll buy, I had 4 different milks in my refrigerator when I had 2 little kids. So, you can do it, and it's worth doing. Other things about the 1-year-old, they should be starting to talk. When it says on there, uses 1 to 3 words. Those are words other than mama and dada. They should already have mama and dada down. So common words. Their siblings' names, very common. Or Bubba or Sissy. S is actually a very hard sound to make. So if they say Sissy, that's really cool. Hi, bye, up. Actually, no is not a common word yet. You don't usually hear no from kids until they're 18 months to 2 years. Those are probably the most common words at this age, but you'd be surprised if you ask the parent, what words does he say? You might get some really funny words, but just depending upon what the parents do when they talk to them. They should be able to wave, they should be able to clap, they will feed themselves, but with their fingers. And the biggest food struggles between 12 months and 18 months are coming from parents who are feeding their kids with a spoon or fork themselves when the child wants to eat independently. And they just don't understand. Either they think it's too messy or it takes too long and they don't want to clean the kid up, whatever their agenda is. Some parents, especially grandparents, will say they eat more if I feed them. That's not the point. Right now the point is letting the child be independent and serving food he can eat with his own fingers. So, you know, lunch would be torn up piece of bread, torn up piece of ham, torn up cheese, and then some apple squares. You know, slice and cut up an apple. Don't make a little sandwich and hold it and have the baby take a bite. That's not, the child's not doing it himself then. Food should be geared to be finger foods. Don't serve a 1-year-old applesauce. They're not going to use a spoon and they're going to make a mess, and then you're going to be frustrated. But you did it. You served the applesauce. So, especially Asian families, the grandmothers, if they live in the home, want to keep feeding the babies. They want to keep them growing and they want to keep them fattened up, and they think this is the way to do it. So there'll be a lot of cultural things you'll come against as well. I encourage parents to start utensils at about 15 to 18 months, but tell them the kid's not going to be good until 18 months to 2 years. So, but they need the opportunity to practice. And yes, I know it's messy. I had 2 kids, but you got to do it. Let's see, dental care again, car seat still facing the rear. Milk, kids need 3 servings of dairy a day. It's really hard to get 3 servings of dairy if you're not drinking milk. I mean, they might like yogurt, but are they really eating enough yogurt? Are they really eating enough cheese? You know, kid will maybe eat 3 slices of cheese, little slices that you not cut into little pieces. If they finish all of that, that's spectacular, but they're not getting a full serving of cheese. So it's really important then for them to be drinking milk. And I encourage them to have a cup of milk with every meal and water in between. Because if they carry milk around and they leave that cup and it gets lost, you know how you find it? By the smell of sour milk. Yeah, that happened in my car a lot. Not so much in the house, but I get in the car and I'm like, somewhere in here is a milk cup. Let's see what else is on there. Okay, there's your autonomy. And they need to be autonomous in more ways than just eating. Let them choose toys to play with. Let them play in the kitchen while you're making dinner with the pots and pans or the Tupperware. Not a cabinet that has glass in it, but something that's safe. So I encourage moms to, you know, leave one cabinet with your Tupperware and your things in it that it's okay for the child to open the cabinet and play those things while you're cooking. That keeps your baby in the kitchen where you know where he is, and you can get your work done and you know he's safe. And I'm a big believer in getting rid of the bottle when they're 1. It's so much easier if they never learn to carry that bottle around. If you let a kid carry a bottle around, at 18 months, you're still going to be carrying a bottle around. At 2 years, they're going to have Coke in a bottle. That's the nastiest thing in the world. So you really, really want to get those kids off the bottle. 1, they don't talk if they're always drinking. 2, they don't potty train if they're always drinking. And 3, their teeth are just gonna rot away, and it's so sad. So the younger, it's much easier to give it up when they're 1, and the way to do that is to start using a sippy cup at 9 months, and really pushing the sippy cup with just watering it initially when the kid's gonna throw it and make a mess with it, so it's not so frustrating to parents. And then when you give whole milk, you never give whole milk in the bottle, you give whole milk in the sippy cup. So then when they're done with formula, they're done with the cup. That's the best way to do it. At a year, we also do this. We do this PEDS questionnaire at 1 and at 3, and it's really just asking the parents, do you think your child has any problems in any of these areas? It'll bring out things that you don't, that you may not know about, but most of the things it brings out are things you're either gonna see yourself on your developmental testing, or like at the bottom it says anything else you want to talk about. I get that potty training on 3-year-olds all the time, but on my 3-year-old form it always asks about potty training anyway, so I'm always gonna be talking to them about potty training. So even though they've written it on there and I'll see it, I would have talked to them about that anyway. But sometimes something does come out that you didn't know about. 15 months, these kids are so much fun. Look at that, is that not a hoot? You see kids drop their spaghetti on their head? Okay, these are straw cups. For those people who don't like sippy cups, kids like to drink from straws. And these can be flipped down, they can be spill-proof, and they're great for parents who don't like sippy cups for whatever reason there is. But it is a nice alternative. At 15 months, their language should be expanding a little bit. They should have 3 to 6 words. And again, I just say, what words does your child say? And I say, how does your child eat? Do they feed themselves? Do they use utensils yet? Are they drinking from a cup? Are they off the bottle? If they're not off the bottle, my first question is, how often are you giving the bottle? Some parents are still giving that bottle 4 or 5 times a day. I said, you've got to get rid of it. Take all the bottles, go to the baby and say goodbye to your bottles, they're going. And they'll walk with the baby and throw them in the trash can. And say, from now on, you get a cup, you're a big boy. And the kid will be like, oh, okay. But if the parents won't let go, the kid ain't gonna let go. So you gotta be very practical about those things. If you want those bottles for the next child or something, you go retrieve them when after the child goes to bed. But do not let them see that you still have bottles around, or they'll want them. So these kids are really, they're walking well, they're probably running, they're crawling upstairs, they're into everything. It can be exhausting for a parent who's used to being able to have a baby who plays at their feet or stays in one area. Now they have to chase them all over the house. And that's why you see those awful baby leashes when you're out in public. I think they're awful, but at the same time, I would never want a child to get lost or stolen. So, and I see that the practicality of it, but I never owned one. Something on here I want to mention quickly is the toddler appetite slump. Between 15 to 2 years, most kids are going to go through a period where they don't eat well. It's just a reflection of not growing as much. So most of them are still growing fine during this period, even though the parents will say, well, they eat 3 bites and they're done. Or I made their favorite food and they didn't eat it. Last week I made mac and cheese, he ate his whole dinner. This night I made mac and cheese, the same box, Velveeta shells, and they wouldn't touch it. And this is the toddler appetite slump. Very frustrating to parents. Kids still grow fine. They eat better with their peers. So if they go to daycare, the daycare's like, oh, they eat fine here. We don't know what you mean. And then the parents go home going, wow, they like the daycare food, but they hate my cooking. No, they like to eat with their peers. So if you can have friends come over, eat lunch together, the kid's gonna eat better. But the important thing at this age is to feed kids food that they'll eat. Don't try new foods when they're not eating well. Give them food the way they're gonna eat it. Don't give the kid a ham and cheese sandwich. If they're not eating a sandwich, give them torn up meat and bread. If they will eat a sandwich, only make them a quarter of a sandwich. If they want more, you can make another quarter. But if you make a whole sandwich and he only eats a quarter, you feel worse because you have all that waste. And then you know what you do? You eat it, then you get overweight, and now you're mad at your kid again.
vicious cycle.
It is, because those children who are starving in Africa need you to eat that food. What you can do is put saran wrap on it and offer to them later if they absolutely don't want to eat. Rather than filling up on snack foods, Teddy Grahams or Cheez-Its or Goldfish or whatever, offer them their food again. Oh, you're hungry? We still have some apple slices and some peanut butter and jelly left from lunch. Let's sit down and have some. Also, remember to teach kids to sit down to eat. Don't let your kid walk around the house eating, because you'll have a kid who won't sit in their high chair. And then they'll never finish a good meal. And so you really want them, we eat in the high chair. When you want out of the high chair, that means you want to quit eating. So if you then reward them and give them, you know, a cookie to walk around with, you just nullified all your actions. So I know, it's so hard to be a parent. I think the most important thing at this age is to instill in the parents healthy diet. Who thinks that a 15-month-old or an 18-month-old should be having Cheetos with their lunch? Do you know that every kid does? Almost every kid is eating chips at lunch at this age. And I was recently reading this really cool study on how to attack this epidemic of childhood obesity. And the only conclusion was, you can't. You've got to prevent it. You can't treat it. So we have to have parents feeding their kids the right foods now. So it seems silly, but I start saying no soda at 15 months because grandparents think it's cute and they're feeding them. And then they go to grandparents' house and they start getting cups of soda. And it's not just a sip anymore. So we need to instill from the very beginning, snacks should be fruits or vegetables, not cookies and chips. If you have to, don't buy these things. The same for soda. Don't give juice. The American Academy of Pediatrics came down on pediatricians years ago. Get kids off juice. I laugh at my mom, who's almost 80, and raised 7 kids. And when we were little, 7 kids, you go through an entire thing of orange juice at one breakfast. So we only got little tiny 4-ounce cups. Well, guess what? The American Academy of Pediatrics says no more than 4 ounces of juice a day. So now I tell her, "Dang it, Mom, you're right all along." We used to beg for more juice. So we really, I found it's much easier than I thought it would be to get kids off of juice. But now parents are doing things like, oh, well, we drink sweet tea. Why? Water. Water, milk and water. That's all your child needs to drink. Okay. These kids are now playing. This is fun. And you can play with them. That's even better. So 18-month-olds, again, they should be feeding themselves, starting to use utensil. Their vocabulary should be expanding. They may be putting words together. Interesting thing to note, a speech therapist who I regarded highly and spent a lot of time with, because my second son had apraxia and we did speech twice a week for 11 and a half years, told me once that kids will not put words together until they have a vocabulary of 50 words. So, when you have your parents say, oh, well, we know about 35 words, put words together, no. Now, they might say yes, you ask them what will they put together. Thank you, bye-bye. They think that's one word. So putting words together is go out, give me, I want, something that means something, not just, you know, bow wow or whatever, you know, things that kids think of as one word. They can start walking upstairs instead of crawling. The big skills at 18 months that I tell parents they should work on. Repeating, that's how you learn new words. Animal sounds, so the see and say toys, the books that you push a button on and they make the animal sounds, and body parts. So when you're dressing your child, give me your hand, show me your arm. We're going to put your head through the shirt. That way they're learning, but they don't even know they're learning, and it's something you're doing multiple times a day, probably more than 2. If you get a busy toddler, you're probably wearing more than 1 outfit and a pair of pajamas per day. So it's a good chance to work on the repetition and the learning. And some children will be ready to potty train at 18 months. Most nowadays will not. I will tell you, my kids were potty trained at 18 months. Nowadays, most of my patients are not potty trained until It's just a difference in our society. Signs that you might be ready to potty train. A child has to be able to handle pulling up and pulling down pants. Because if they can't go to the bathroom independently, then what's the point of potty training? They have to be unhappy to be wet or dirty. If they don't care, you're not going to have them motivated to potty train. They have to be able to hold their urine. So if they can wake up after a nap dry, especially if they wake up dry in the morning, they're ready to potty train. But again, they need to be unhappy to be wet. If they don't care, they're not going to potty train. What else is on this one? Again, the nutrition aspects, off the bottle. If they're not in daycare, not so much by 18 months, but definitely by 2, I encourage some way to play with other kids their age. Be it a church nursery, be it going to the park, the indoor playgrounds at the mall, somewhere where they can play with another kid their age. Because say you have a 2-year-old with a 7-year-old sibling, and the 2-year-old wants the toy, what's the 7-year-old going to do? Let him have it. No biggie, right? Well, is that child going to learn how to share? So they got to have another 2-year-old to have tug-of-war of that toy and learn how to play with other kids their age and how to share. It's very hard to learn to share if you don't have experience with kids your age. And parents will say, oh yeah, they play with their cousins. How old are the cousins? 11 and 13. That's not a kid who's going to learn to share. So I really encourage them, okay, your friends have babies your kid's age. You need to get that kid out there meeting other kids, or look at a Mother's Day out once a week. Somewhere to give them some way of socializing. At 18 months and at 2 years, we do the MCHAT, that stands for Modified Child Autism. It should be screen, but I think it's test. And the goal nowadays is to diagnose autism by age 2 so that you can get early intervention, and by the time they're ready for school, they're already in services. That gives them the maximum potential. That's why I said, when I would look back at 5-year-olds, no way did they develop autism at 5. So this is a nice screen. There are only 4 no's on this whole thing. And after you've done it a few times, you know which ones those are. And after you've taken care of enough kids with autism, you will see why this is a very good screen. It's not perfect, but it's a good screen. Some of the kids who might be abnormal at 18 months repeated at 2. If they're normal at 2, and they were abnormal at 15 or 18 months, they're going to be fine. If they're still abnormal at 2, you probably have an issue. Oh, damn it, that's the answer to this. When I'm at that case, I will actually talk with the parents about everything that's not a correct answer to see what their perceptions are. Because some of the questions parents don't understand what they mean. So when, there's one that says, does your child make funny movements with their fingers in front of their face? It's number 18, I think. They don't know, well, what does that mean? And I'm like, it's something that you would identify as weird. Not just a kid who looks at their hands when they're dirty, but maybe a kid who, you would not think a 2-year-old would do that and be normal. So a lot of times then parents will reevaluate their answer. If there's just one off, I'm not going to make a big thing about it to the parents. But if I see that they're getting a significant number off, I really want to, okay, really what's going on with the kid, and make sure that, do we need to do more evaluation? Do we need to start doing some therapies? Where do we need to go with this information? That's the answer. The ones that say C on there are criticals, so if they get those wrong, they are more significant than if they get the other ones wrong. And it's like, you're allowed to miss 2 regulars, but if you miss 1 critical, that's more significant. So, I just thought this was the cutest picture in the world. The dog's almost as big as the kid is. Who would let their 2-year-old go walking down the street with a dog, right? Good babysitter. Okay, so 2-year-olds, besides needing to socialize, they're starting to show their temperament. Okay, so this is where we start getting the temper tantrums. I've seen younger kids have temper tantrums. I've seen it even under 1. The most important things that I tell parents about temper tantrums, one, realize it's normal. Two, look at what caused it. It's usually frustration, either something they can't physically do yet because they don't have the skills, or something you won't let them do because of a safety issue. Like, they want to go play in the front yard while you're inside, you're not going to let them do that. That's a safety issue. But, so that's usually what starts a temper tantrum. If you have kids who are throwing temper tantrums and there's no identifiable causes, that's a little bit more concerning. The best way to extinguish temper tantrums is to ignore them. Kids use them to get their way or to get their parents' attention. So if you walk away from your kid during a temper tantrum, a very hard thing to do, and don't give them the feedback that they want, you're going to get rid of them a lot faster. I tell parents, walk into another room. If you need to peek around the corner and make sure they're okay, you can, but don't let them see you, because that gives them the feedback that they want. After it's over, just go back to acting like normal, or you might want to, are you okay now? And then go back to acting normal. Talking with a 2-year-old about what happened and why they do a temper tantrum is not going to get you anywhere. They do not understand. It might make you feel better, but you can often avoid them. If it's something that you know is going to set off a temper tantrum, they want a toy they're not allowed to have, they want their sibling's toy, they want to play with their phone, which, by the way, the American Academy of Pediatrics says 0 media before 2. I can't tell you how many 6-month-olds are looking at pictures of themselves on phones when I walk in the room. I'm like, really, can you not play with your child another way? There's a whole slew of toys, books, and other things in this room that you can be using besides your cell phone. But, now where did that come from? What was I saying? Who knows?
What things the temper tantrums?
So, yep, that's pretty much the majority of temper tantrums. Most kids are going to be done with them by 4. Some kids will still have them in their 3s. A kid who's having temper tantrums at school, you have an issue, so you need to be looking at that issue. Kids should not be having temper tantrums in the school environment. They should be, at that point, understanding rules and what they have to do when, and not throwing fits about it. So the great thing about 3 is that they can learn to play games and play with other kids. So if you look at your Denver, you'll see one of the things that starts at 3 is, does your child play board games? And we all think, board games? Well, okay, 3-year-old board games are Candyland, Chutes and Ladders, Hi-Ho Cheerio. Who remembers these games? Yes. Even at 3, my kids like to play Trouble. Push that thing, and it jumps around. They like that. A 3-year-old will make their own rules to the game. But that's okay at first. I tell parents, ease into rules. If you have older sibs, have them ease back a little bit. The new kid starts playing games, they're going to make their own rules. And you remind the older sib that you let them do that too, and we'll get them to understand all the rules of the game as they get a little older. Sometimes you can't have the 6-year-old play, because they want to play by the rules, and the 3-year-old doesn't understand the rules yet. So, but it is fun. They'll start being like someone you can enjoy. Yeah, only sort of. Okay, they also have to start learning some more self-help skills. So, learning to dress or undress themselves, learning to ride a tricycle, and the big thing of that is the pedaling motion. And I swear most kids don't get tricycles anymore. It's really sad. But most daycares still have them, or at least a big wheel, so they can learn that motion. And people go, well, why do we even need to learn that motion? Well, it makes you run a whole lot better. So a lot of kids are want to learn to run well, sports and everything. Bicycling can be very helpful for that. Also good balance. In speech, they're not just using sentences now, they're using plurals. They should start understanding adjectives, mean, nice, pretty, opposites, hot, cold. That may be more of a 4-year-old for opposites. Their speech should be much clearer, whereas a 2-year-old, maybe only the mom understands them and strangers don't. A 3-year-old, pretty much everybody should be able to understand them. A 3-year-old should count to 3. A 4-year-old should count to 10, not 4. But you'll see 3-year-olds who can count to 10. You'll also see kids who, you know, one day they count 1, 2, 3, 4, 5, and the next day they count 1, 2, 4, 5, and the next day they're 1, 7, 5, and that's all normal part of learning. So if you go through that with your kid, don't get frustrated or worried. It's normal to forget a letter or reverse them. That doesn't mean you're dyslexic at 3. 3-year-olds should know colors, maybe not mauve and lavender, but purple and pink. And they should have the concept of 1. Okay, does anybody know what that means? Kids can rope count 1, 2, 3, 4, 5, but they may not actually understand that this is 1 object and this is 5. But by 3, they should understand this is 1 object, and you should be able to put it down and say, count that, how many are there? They should be able to go, that's 1, not just go 1, 2, 3, 4, 5. If they do that, because then they're just rote counting, they do not understand the concept of 1. But most 3-year-olds will understand that. A 3-year-old should be able to tell you, my name is Johnny, I'm 3 and I'm a boy. My name, my age, and my sex. I encourage kids, even at a year, to read. I tell parents the best way you can push your kids' speech development is to read to them. And parents say they don't like to sit still. I said, I don't care. Put them on the floor with blocks or some toy they can play with. Still read to them. They'll be listening to you, even if they're not looking at the pictures. That's going to improve their speech more than anything else you can do. My second one never liked to sit to read. We bought action books. I don't mean Batman and Robin. I mean books that you could touch. You could open a flap. You could pop up. I mean, they make some incredibly cool books out there nowadays. Not like when we were younger. Oh yeah, they were just black and white back then with the TVs. But really, when I got married, I had a black and white TV. I tell older siblings, read to your sibling. You need to learn to practice reading out loud. It's good bonding for the two of you. It gives mom a break to get something done. It's a good thing to do. Everyone should be reading to that child, dad included. But reading is so important that I can't emphasize it to families early enough. Trying to see if there's anything else on there different that we need to talk about. Okay, if your 3-year-old's not potty trained, that's what I want to talk about today. First of all, I try to figure out why. Okay, do they not care? Are they resisting, refusing to sit? What's going on? And then I tell parents, this is the best way I can tell you to try to potty train your child. Give them a break. Quit talking about it, quit asking about it, quit taking them to the potty for at least 2 weeks. All pressure off. Change his diaper, don't talk about it. Just change his diaper, good, you're dry, go play. Then start talking about potty training. Okay, we're going to start potty training in 10 days, 2 weeks, whatever it is. You're going to pick a date, that's our day, we're going to start potty training. You and me, nobody else. A lot of times kids who go to daycare, they might have 5 different people taken to the potty. You're going to have individual variations in what parents or what mom does versus what the daycare does. So if it's just 2 people together, either dad and the child, mom and the child, older sib and the child, whoever's going to do it, full on pressure when you start. So you say, you and me, we're going to do this. We're going to go to the potty when we get up. We're going to go to the potty after we eat. And we're going to sit there and we're going to have success. Just a positive attitude, a little bit of talking about it every day. Every day you count down. Okay, 5 more days. Tomorrow we start potty training. Today's the day. You get up, you go to the bathroom. Sit on the potty. You sit on the floor with the child. You give it 10 minutes. Run water if you need to. You know, put a kid's hand in water. They pee, summer party trick. Probably had it done to you at some point. So anything you can do that helps the kid pee in the potty, then you throw a party. Yay, Mom, you did it, so proud of you. Oh my God, this is what Mom's been wanting me to do? Just pee in the potty? So some of those kids don't even understand what they're supposed to do. I knew my kids were ready to potty train when they would stand in the bathtub, standing in warm water. And they would go, look, Mom, I'm peeing. Okay, now they got it. They saw the pee coming out. They knew what that was going on. I'm like, see that? That's what you ought to do in the potty. So after you sit down that first time, they may not go, and you just say, no problem, dude. We're going to try again after breakfast. We're going to try again. And, you know, some parents will let them run around with no diaper on. You're going to pee on your floors. You might take them every 10 minutes. You're going to wear yourself in the kid out. Every 2 hours is often enough. If they don't go, yeah, they might go before you go again in 2 hours. But that's okay. You don't want to sit there every hour for 10 minutes. You're going to drive yourself insane. But if you go every 2 hours, if you go after naps, after eating, your body has a natural gastrocolic reflex, so most people are going to want to pee and or poop about 20 minutes after they eat. So take advantage of the body's natural mechanisms. Take your kid potty 15 minutes after you finish eating. Sit with them so they stay long enough. Tons of praise, nothing negative. If your 3-year-old still isn't interested, this is the best trick I know. Mommy's jar, Johnny's jar. Mommy's jar is full of pennies. Johnny's jar is empty. Every time Johnny does something positive, he gets one of Mommy's pennies. So what are the positives? Sits on the toilet without arguing. Pulls up and down his pants himself, if that's been an issue. Pees in the potty, maybe you get 2 pennies for that. Poops in the potty, you might get 5 or 6 pennies for that. But also, if they refuse, they lose pennies. So, I don't want to go potty. Penny in my jar from yours. Not sitting long enough. Penny in my jar, you can go play, but I get your penny. And so, at 3, kids start to understand money. So, money talks. Money talks to 3-year-olds too. Set up weekly goals. If you get 5 pennies this week, hopefully it's higher than that, you can earn a trip to the park. You can choose what you want for dinner. You can have extra reading time. Quality things, not things you buy. Maybe one big ultimate present. Ours was Big Muck. Bob the Builder. Okay. Big one was about this big, not the little guy. And that was for when we were done potty training. Joel was potty trained at 2.5 while we were on vacation, because that's the only time I had one-on-one time with him. The first day, 15-hour car ride to Ohio, only went twice. Not bad for a start. The big boy pants by day 5. But it was just he and I really do, part of the issue, so many different people at daycare, dad, just lack of consistency. He'd get good and then he'd drop out. And it was very frustrating. Of course, some of it was probably my fault, because I really thought after he picked up his brother's sippy cup at 9 months and started drinking out of it, he'd also just follow his brother in the bathroom and pee like his brother did. That didn't happen. Okay, at 3, we start doing other things besides the Denver and the cat and clam. These are block skills. You can do block skills as young as 18 months, which actually some of those are part of the Denver. But these are different block skills that children should have at different ages. And I actually have a card, like a little flip card thing with the ages written on it and the pictures of the blocks. And I say, okay, build me this. And if they don't get it, then I will take blocks and build that shape and then have them do it. Most kids can do it just from the picture. And you look at that staircase for 6 years and think that was the easiest thing to build on the whole sheet. It's not. I don't know why, but it's not. But building blocks is a ton of fun. Much more fun than most of the other stuff we do. Okay, school shots are due. Some schools require them for kindergarten, some schools require them for pre-K. I give them to all my 4-year-olds now. And let me tell you, after doing this for 30 years, 4-year-olds take shots much better than 5-year-olds. 5-year-olds have been scared to death by siblings, friends, or who knows what. So 5-year-olds are great social little people. They are ready for the school world because they want to please, they want to learn, they want to do things. So again, we talk about the same thing. Who's living at home? what concerns you have about your child, how well are they eating, are they meeting these developmental milestones? I talk about riding bikes, I talk about bicycle safety, helmets, 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 helmets. If you didn't know, one child a day dies in the United States from a head injury from a bicycle wreck. That's what I tell my kids. I also tell them if they fall off their bike and they break their arm, I can fix it. If they break their leg, I can fix it. But if they fall off their bike and they break their head open, I can't fix it. That's why they need to wear a helmet. When you say something like that to a 5-year-old and they're just absorbing at this age, they're like, helmet on. I also tell them tennis shoes, no bare feet, no flip-flops. Those are setups for accidents. Swim lessons, I think everyone should learn to swim. In Oklahoma, so many people have pools, even if they're just a small or above ground pools. Everyone should learn to swim. So I always talk about swim lessons, floaties, supervision, all of that stuff. And I always encourage swim lessons. And I tell parents, like I said, every summer, I made my kids take swim lessons at the beginning of June and at the beginning of August to see how much they learned that summer and how much they remembered from the year before. We had an in-ground pool, so that was super important to me. Plus, we used to go to the lake a lot, and they still had to wear vests in the lake, but I needed to know that they could survive if something ever happened. Okay, adult seatbelts. This is not that they're going into them at this age. This is when we say, what are you riding in? Are you still in a 5-point restraint? If you still fit in that, it's the safest, stay in it. If not, high back booster, low back booster if you want when you get older, and for some reason you feel more grown up in a low back booster, but really there's no big difference. They still raise you up so that the seatbelt fits correctly, and that's what it's all about. That's what I tell kids. That's all it is. Now you can see out the window. Without that, you couldn't look out the window. You'd be bored. So I try to tell them why we tell them to wear seatbelts, not just to wear seatbelts. And yeah, I know they want me. Dental care. They should start seeing dentists at 3. Some dentists tell the parents, oh, we don't see them till they're 5. I tell them if your dentist won't see them at 3, there's a lot of good pediatric dentists in this city. Find a pediatric dentist, see them. If you want to move them to your adult dentist when they're 5, that's fine. But they still need to be seen a dentist at 3. Don't not see a dentist because your dentist won't see them that young. Again, I tell them, look at how well your child's brushing their teeth before you quit brushing. When they start school, I think every kid should know their phone number and their address. So I ask them, what do you know? Where do you live? A lot of times I can get they live in Oklahoma, they know that. They might know they live in Oklahoma City, but you'd be surprised how few kids actually know their address. And cell phones, we have all kinds of retrieval systems. How many phone numbers do y'all know now? Like, I know my husband's and my mom's. I don't even know my son's. So, but if they're calling from school or they're with a police officer who found them lost, they need to know the phone number. So I can't stress enough to my parents, you've got to teach your kid your cell phone number. They've got to be able to reach you anywhere. Reinforcing well-balanced diet. Talking about a fire plan, that's kind of cool because we really haven't talked much about that before. You know, what to do, where to meet, how do you get out of the house, make sure everybody's out. Stranger awareness. When they're little, I tell parents, stranger anxiety, kids who scream at strangers, that's God's safety mechanism that keeps someone from stealing your child. But at this age, they've got to understand that strangers can be kind and luring, and it's very easy to go with somebody who's nice to you. But if they don't know them, they shouldn't do that. So it's a whole different approach. It's not stranger anxiety, it's stranger awareness. It's stranger danger. And I mean, shoot, I live in a quiet cul-de-sac, in a quiet neighborhood, and the house on the corner, 2 houses away from us, the little boy was 4 and a half or 5, and the stranger almost got him into his car. And I don't know how it was stopped. I don't know if a parent ran out or what. I don't remember what happened. We were just all freaked out that that happened right there in front of our faces. No one was outside with the kid. That never happened at my house. And reading. Kids can get library cards at 5. Not that they need them, but it makes them feel grown up. And libraries now probably don't even give out cards half the time anymore, but giving a kid a library card is a big step to a kid. So I tell parents, if you don't go to the library, go to the library. Libraries are cool. They're way different than they used to be. They're fun places to go. They'll encourage your kid to read and to learn. So take them to the library. Oh, well, they go to the library at school. Take them to the library. School shots and boosters on shots they've already had. They're combined now, so instead of getting 4 shots like they used to, they only have to get 2, which is like way cool. And then you tell them, you don't need to get shots for another 8 years. By then you won't even remember what a shot's like. And then you say to the parents, but you still need to come in for yearly visits. Because otherwise they won't come back to their child. Because they don't think they need child visits. They think it's all about shots. We think it's all about keeping them healthy and making sure they're growing up well. Okay, this is something different we do at 4. This is a readiness assessment for preschool, and for most kids, most of those should be checked. If there's a whole lot of blanks in there, you ought to have a feel for that already from doing your developmental testing. But if not, you might really talk to the parent about what's going on. Sometimes parents who've been at home with kids who've been at home with parents who haven't been in Mother's Day out or daycares in any type of learning environment may not be doing a lot of these things. So school may be a big shock to them. So taking a few minutes to say, hey, before school starts, why don't you guys work on cutting with scissors? Why don't you learn how to pace? Because he's going to be doing those things. So he needs to be practicing those things. And these are things you need to be talking about and looking at so when he goes to school, he's ready. The first half of this is the Giselle, Jesell test. And for 3-year-olds, the first shape of circle is what they should draw. Then it's 4, 4.5, 5. The rhomboid is 6, and so is the square with the lines through it. The perfect diamond is 7. The 2-dimensional cross is 8. The cylinder is 9, and the cube is 11. So I like it when my nurses put down 3.5. 3.5, they can either do a circle and a cross, or they can do just a circle. There's no 3.5. The second one they do is, we tell them to draw the best person they can draw. And if they don't do enough, I say, I know you can do more. What else do you want to put on that face? What else do you want to put on that body? And I push them to draw a little bit more. That's called good enough Harris Draw a Person. Upcoming are the scoring systems, and then you can see if they're meeting the developmental appropriate age. There's the Giselle figure key, I told you those ages. And the good enough, you actually have to go through it and score it, total up the scores, and then on the bottom you can see where it compares to the age. And on a kid who's developing normally, there's a great correlation. You'll be amazed. All right. School-aged, we now do this pediatric symptom checklist, which picks up a lot of school issues. It'll pick up anxiety, separation anxiety. It'll pick up maybe clues to attention deficit disorder or clues to learning disability, but higher scores are going to be associated with more problems in school. So if they only check 6 points, that's absolutely fine. You don't have anything to worry about. But you'd be surprised when you ask how's school, how many parents will go fine, and then you see that they have a score of 35 on here, and you're like, okay, well they scored a little bit high on this. Let's talk about what problems there are. And if they don't bring it up, then you can say, well, why did you say that this happens often? And then you can get them to start expressing the problems. And maybe you don't have time to do that at the visit, but you can always say, I see a problem here, we need another visit, have you come back in and talk about this? Because this is not going to be a good school year if these are going to be his scores. So if a kid's got 35 on there, they're not going to succeed in school. There's the breakdown. This is a quick reading assessment. And if you want to use it, it's designed that you can also use it to teach about safety. I just use it for reading because, man, I'm running out of time by now. All this stuff we're talking about every visit. And I start the kids even in first grade, read as much as you can. If they can't read much, I'll point to the words go, no, of, dog, Most kids should be able to read those even in first grade, even if it's the beginning of the year. And if not, try to sound it out for me. If you have a kid who really does poorly on it, and there's a key to it too that tells you where they should be, then you know they've got a learning problem of some sort involving reading, and you can start getting a little bit more from the parent on what's going on and do we need to do any intervention, or many times they're already set up with the school and fine, but you're just trying to make sure that, you know that motto they went through for a long time, what was it, no kid, yeah, left behind, you know that's not in use anymore, but there's a scoring thing for it. Many kids were still left behind. After about 12, we don't do the development anymore. We give them a standard questionnaire that scans for depression. It screens for alcohol use or exposure and eating disorders. I'm not going to go through these because we're almost out of time, and I want to you all have questions if you have any. And I want to tell you that many pediatricians think that pediatrics ends at 12 and they don't want to see teenagers. I find that sad. I love my teenagers. Well, okay, so I almost did an adolescent medicine residency, but you know, I'm in the military and they didn't see that need, so then there's no way I was going back and do the residency once you've been making money. That didn't happen. I used to cut my kids off at 18. Bye, I love you, bring me your kids when they're older. Now I say, as long as we're not so busy, you can keep coming here. But there's going to come a point when you have an adult disease I don't know how to take care of. You do workman's comp, which I don't do, or you get married and have a family. Those are then you're out of here. But I'll see my 18 and 19-year-olds still. And adolescence is a time of a lot of changes. They have a lot of homework, school pressure, they have the whole media exposure, they're learning to drive, they're active in sports, their priorities change, their friends are now more important than parents. So teenage years are a big deal. And it's really good to keep that connection with your teenagers, because when something goes wrong, then they'll tell you. But if you haven't seen a kid for 4 years and they never felt like they could trust you, they're going to come in and talk to you about problems. Form changes just a little bit to reflect the different needs of a teenager, talking about periods, talking about dating, talking about driving, talking about peer pressure, just kind of reflecting the changes in their own lives. This is the CADS, which is the depression screen, CRAFT, which is the alcohol screen, and SCOFF, which is the eating disorder screen. Immunizations are very simply put, they tweak this every year. They haven't changed it for a long time because there haven't really been any new vaccines. The newest vaccines are mostly teenage vaccines, 2 meningitises now at 11 to 12 and again at 16. Trememba, which is meningitis B only for military recruits and college freshmen living in dorms. And then everybody already knows about the tetanus booster then. There's combined vaccines that are new. Those are reflected in here. You can use combined vaccines. You can use separate vaccines if you want to. There's really no need to. I do have some weirdo parents who like to separate them and spread them out so their child gets like a shot every month instead of 2 shots every 2 months. So if that's what they want to do, I will buy the separate vaccines for them because I'm all about whatever it takes to get you vaccinated. I hate the non-vaxxer epidemic we're in the middle of, and unfortunately I can talk myself blue in the face, and I don't know why my medical degree is not as important as what they read on the internet. So it's very hard to talk somebody who's talked themselves into being a non-vaxxer into vaccinating their child. Even I had a kid who refused all vaccines, was hospitalized for Haemophilus influenza with pneumonia at 9 months. And I said to the parents, I never want to say, I told you so, but this could have been prevented if you vaccinated their child. They just didn't come see me anymore. So you can't, once they've made up their mind, it's very hard to change. Now, if somebody's coming to you to ask you what's important about vaccines and why they should do it, they're still open-minded. You can give them good information, they can make a good decision. But if they've already come to you saying, I'm not going to vaccinate them, you can talk as much as you want, and you might flip 1 or 2 of them. but it's a very frustrating, time-consuming experience, and you're probably not going to have a lot of success. And I've even read a couple of studies that say the more you sort of try to inform and encourage, they consider that pushing, and it turns them away. And they're less likely to change their mind than if you just let things be. So 30 years ago, when I was at Tinker, the first time I had a non-vaxxer, mom says, I don't want my child to get the T part of DTP. Give me that vaccine without the P, without the pertussis. And I said, no. And she said, why not? I said, because of all the things on there, tetanus, pertussis, diphtheria, your child's more likely to get pertussis. That's when he needs to be vaccinated above all else. Well, then give me a half dose. I said, no such thing exists. I said, I'm not giving your baby a half dose. We're going to give a dose of vaccine, your baby's going to get immunized. She walked away and refused to do anything. She was back in a few days. Because somehow or another, her commander found out. Her husband's commander found out he didn't vaccinate his job. And she had to bring him in and get him vaccinated. Okay, that did not endear her to me. I did not rat her out. I don't know how that happened. But that's the first I'd ever had of a vaccine refusal. And then I didn't see it again until all this recent stuff. So it's really a new wave thing. And if you don't pay attention, you may not realize the consequences of it. 3 cases of mumps at OU in the last month. Mumps. A male with mumps gets what? What risk? Orchitis. Infertility. From a vaccine preventable condition. So sad. My 15-year-old, he and 3 of his bestie friends in high school coughed and vomited for 4 months. He lost 15 pounds. What did he have? Vaccine preventable disease. He was vaccinated against pertussis. Him and 3 of his friends, they were like this, 4 of them. They were in band together, they were in all classes together. All 4 of them got pertussis. All of them had been vaccinated. But somebody got it from somebody who wasn't vaccinated, and boom. So it's still out there, and that's why we need to keep vaccinating our kids. Measles, well, I've heard about the outbreaks that usually started by somebody coming from another country and then exploding in under-vaccinated populations. California, the Disney exposure a couple of years back. And apparently there's big pockets of unvaccinated people in California. I guess there are even more non-vaxxers than there are in Oklahoma. But yeah, we're seeing things that I would have told you that you're never going to see chickenpox. But I'm going to tell all of you that you will. And chickenpox looks a little different after the vaccine than it does without being vaccinated. So you got to know what chickenpox looks like. You got to know what chickenpox looks like after a vaccine, because as long as it's out there in the under-vaccinated population, your kids are still potentially can get it. The first dose of chickenpox is, I think it's 85% effective. So you're still going to have 15% of kids until they're 4 and they get their second dose who can get it. I recently had a 9-month-old get chickenpox. I don't know where she got it from, but guess who got it next? Her mama, who had never had it and never been vaccinated. So she was way more miserable than the child was. So yeah, chickenpox in adults is a lot worse disease than it is in kids. So, and non-vaxxers take their kids to chickenpox parties. If you've never heard about those are real. One of your kids gets chickenpox, you call all your friends, they all come over so that their kids will get chickenpox on purpose, so that they don't get as an adult when they're more likely to have complications. But guess what? What does a chickenpox vaccine prevent besides chickenpox? Shingles. And I've seen kids with shingles once they had chickenpox. Then I'm a firm believer that vaccinating with chickenpox is going to help prevent shingles in adults. Of course, now they have the shingles vaccine. But you know, you're not supposed to get that till what, 65, 50 if you're at high risk. And Susan and I got it one year. Because I figured I can't afford to have chickenpox. I got it when I was 5. I probably have great immunity to it, but I can't afford to miss a week of work. And you're contagious before you break out. I don't want to expose my population. I don't want to have shingles and go through the pain don't know if y'all remember David Letterman, he was all before your time. He got chickenpox on his face, in his eye. He was over 6 months born. It's a lot of money, people. So, be sure to vaccinate yourself if you haven't. Just read a news update that Gardasil is now approved for women up to 45, no longer 25. So if you haven't been vaccinated, get yourself vaccinated. Make sure you're vaccinated against hepatitis A and B, even if you weren't when you were younger. Get the meningitis vaccine. You never know when you're going to be exposed in medicine or something. So take care, you too. Questions?
How many people would you say that you see now that are anti-vax?
Well over 5% of the practice.
Wow.
Yeah. And unfortunately, once you start, I don't want to say tolerating it, but you quit fighting it, and I look at it this way. I've been doing this 30 years. I know what these diseases look like. I can recognize them in a kid who's not vaccinated. But you take a brand new doctor who's never seen chickenpox, who doesn't know what hepatitis looks like from Haemophilus influenza B. They're gonna miss these things. These parents need experienced people to pick up on the problems that their kids are at risk for because they didn't get vaccinated. Well, now, Dr. Johnson, she's okay with you not vaccinating. No, I'm not okay with you not vaccinating. But if you're not going to vaccinate, you still need to come in for well child visits. We need to know your baby's healthy and growing. And I still want to know that your baby's okay. I don't want to see a family who only comes in for a newborn visit, doesn't show up again until they're 7 because they're not getting shots. Yeah, I know. That's my answer. What else?
When do you suggest stopping pacifiers, and do you think they actually mess up teeth?
Okay. A lot on pacifiers. First of all, why do we use them? Babies need self-soothing. And if you don't give them a pacifier, and they need it enough, they're going to suck their fingers or their thumbs. They will find a way to suck. And it is a very calming, helpful thing for a newborn. So they're not bad. Everybody thinks pacifiers, oh, they're so bad. They're really not bad. There is a higher incidence of ear infections in kids with pacifiers if they're in daycare. And let me tell you, that is the stealing and sharing of pacifiers. And you know, when you got a kid with a pacifier in their mouth, and that other 18-month-old wants it, he's just got to pop it out of it and put it in his mouth. And you can't get there fast enough to solve that. So that's just a normal thing. But I recommend to parents that the pacifier be out of the mouth during the day at 18 months so they can start talking. And they can still have it for nights and naps. And if they want it all the time, you say to the child, when you need your pacifier, I see that you're sleepy. So whenever you want your pacifier, that tells me it's time for you to go to bed. So if you put that child in their crib every time they want their pacifier, they'll give up that pacifier during the day pretty quick. Orthodontically, the dentists say it doesn't hurt their mouths until 4. I see kids younger than that, if they're heavy pacifier users, have some shaping, but I think that when they say that, that means that'll self-correct with time, and it's not going to be a permanent setup for braces or something in the future. But definitely by 4, I'm very worried if the kid's not giving up their pacifier. Like, okay, let's change this up for a more age-appropriate transition object. A doll baby, a teddy bear, a blanket, but not a pacifier anymore. But for the little kids, they serve a good purpose. They're not always bad. I know y'all are starving and need to stretch, and so I'll just sit here for a few minutes. You can go, and if anybody has any questions, they can